Rescue efforts are underway for residents trapped in floodwaters in parts of North Carolina. So let's take a look at the challenges they're going to face, both the rescuers, the people who are going to have to clean up behind this. Fox News medical contributor Dr. Marc Siegel is here to weigh in. Dr. Siegel, always good to see you.
Great to see you, Shannon.
Okay, so let's talk about, first of all, we've talked a lot about the flooding, and that presents a big challenge. But what happens to that water? People don't have electricity, filtration may be down for a while. What are some of the health concerns you'd have in these coming days?
And the flooding is not over yet. And the more flooding we see, the more people that get separated, the more power we lose. We have 700,000 people already without power. You know, when you're without power, you may not have the medical supplies you need. You may not have the respirator you need. You may not have access to the dialysis you need. Well, here's a big story. Not only has it been called a public health emergency by HHS, but they also know what your medical needs are because patient privacy is suspended. So, Shannon, they come to you with batteries for the respirator if your power is off. The biggest challenge right now is getting emergency responders to the areas where people are stranded, where they're trapped. And if you're in those floodwaters, as Rick Leventhal was saying, you know, there's plenty of animals in those floodwaters as well. Pigs, there's a lot of bacteria, there's a risk of diarrheal diseases, there could be a power line down, there's a risks of electrocutions. That's happened already, trees falling on people, debris hidden below the water line, you can get injured. You get injured, you get a wound, there's no way to clean the wound out. So those are the major challenges we're facing. FEMA has been really rushing to the rescue here. Over 1,000 FEMA workers involved, HHS, state, local, National Guard, over 4,000 people involved. It's really been a tour de force of state, local, and federal authorities here. Over 6 million meals are being sent to the area, over 4 million liters of clean water, but keeping that water clean and getting it so that people get to drink it and it doesn't get contaminated, that's a huge problem, and that's what we're looking at going forward.
Well,
we have to keep vigilant.
Yeah, and the president tweeting tonight, great job FEMA, first responders, and law enforcement. Not easy, very dangerous, tremendous talent. America is proud of you. Keep it all going. Finish strong. Yeah, we try to send them encouragement, as you note, all the things that they're facing. What about when folks try to go home? They'll have to wait until authorities allow them in many of these areas, but we always hear that people are very stressed. They're emotional over what they've lost. They've got a lot of physical work to do a lot of times that they dive right into. What are the challenges there?
By the way, Shannon, the president is absolutely right. I think FEMA's response has been unprecedented. We've learned from prior disasters, and one of the things we have to learn is not to go home too soon. Because if you go into a house that doesn't have power right, or again, broken items, you trip, you fall, you might get stressed, you could have a heart problem. I mean, we have to look at what people's underlying medical problems are. So the last thing you want to do if you've been evacuated from your house is to rush back in. And that's another big mistake. You have to listen to the authorities that are telling you what to do. And the most important story here is it's not just that the federal authorities are coming in, that FEMA's coming in. They're talking to the state and local health authorities to figure out who's who and what to do. And that so far is working, but we're a long way from over yet because, again, we're going to see more floodwaters and we're going to see more trouble for emergency responders getting in to help sick people. We got to get people the medicines that they need as well.
Absolutely, absolutely. If they weren't able to take them with them or if they've lost them in the process. Dr. Siegel, such good advice. Thank you so much for dropping in.
An amazing response. Thank you, Shannon.
I'd say late, but it's early. So dropping in early. Thank you.
Very early. Thank you.